Well, hello, listeners, and welcome back to Our Experts. I'm your host, Carol Matichka, and we are very lucky today to have with us Kevin Duane. Dr. Duane is the owner of Panama Pharmacy, and he's come on with us before and brought us some great information. I've been very excited to have him come back again with us to really share his expertise, talk to us about being an independent owner and what that means, and give us some updates on the legislative session. So, Kevin, you're also our President Elect for FPA, so congratulations on that as well. And why don't we go ahead and get started? But welcome.
Thank you. Yeah, no, I'm excited to be back, and this is a good topic for us.
Yes, absolutely. So you really are a true champion for pharmacy, and it's been so impressive to just watch you grow over the years and really mentor me in many ways.
Okay.
So I really appreciate that. But before we get into some of the other questions, your pharmacy has really been an integral part of our community here in Jacksonville for quite a while. So can you tell us about your independent pharmacy and Panama Pharmacy?
Yeah, so Panama Pharmacy has been in the Jacksonville community since 1928, and I just think it's so fun. You know, when we were walking in here, I had one of the employees say that, you know, they remembered us when we were on the other side, and we used to have a soda fountain, and I hear stories like that all the time. It's so cool to be able to carry on a legacy for Jacksonville like that.
Yeah, that's fun.
Like I said, we've been since 1928. It's been family-owned for its entire existence, and, you know, we've been a cornerstone of the north side of Jacksonville, really serving that underserved and needed community here for a long time.
Yeah, that's fantastic. So thank you. So one of the things I wanted to talk about today, because we haven't talked about this yet, is test and treat. So I know that you do some test and treat, and maybe not everybody who's listening has a full understanding of what that means. So can you share a little bit about test and treat?
So, test and treat was something that the Florida legislature had looked at for, you know, years past, but the pandemic really accelerated and I think made very obvious the need that pharmacists could be well positioned to be points of access for people who needed treatment for small acute conditions in the community. So, of course, with COVID, we did a lot of COVID testing and, you know, respiratory influenza testing. But it's so much more than that. And as we hear stories of doctors and hospital systems being overstressed with patient loads, being able to act as pharmacists to really take some of that burden off and treat some of those people who otherwise would either not be able to see a practitioner or really overstress the system has been something that I've been very proud that we've been able to do here in the community.
Absolutely. And the repercussions of that, if they don't get care, if you want to talk about that potentially.
Yeah, so I think that, you know, two things we can see when someone doesn't seek out care for conditions. Number one, they can get worse and then they, you know, add to the stress of an already overworked emergency department or, you know, urgent care system. Or number two, you know, there may be primary care doctors, you know, internal medicine groups, they're also overstressed. So
Sure,
even those typical
absolutely.
office visits, you know, being able to get in a day's notice or 2 days' notice can be very difficult for people. So they can sometimes just go untreated and, you know, they suffer with, you know, whatever it is that they have for that time when they really don't need to.
And then I think about influenza, and if that is what they test positive for, what's the risk there?
Yeah,
with
they also
timing?
end up,
Sure.
you know, spreading, and when they don't get adequate treatment and early treatment, then, you know, their viral loads, whether it's COVID or influenza, can be increased, which we know leads to increased transmission risks. So there's a lot of public health.
Absolutely. Well, and we also have that short time frame for them to get something like Tamiflu if that's what's necessary. So thinking about all those things, so it's wonderful that you're able to offer that. So how can a pharmacist who currently isn't providing test and treat at this point in time, how do they go about doing that?
Yeah, so if you're like me, you know, we covered in our curriculum in school certain aspects of treating, you know, acute but simple conditions. But the legislature really opened this up to the point where you need some, familiarization with what the law allows you to do and does not allow you to do. So definitely taking an educational program, a continuing education program or something like that, that helps you to familiarize with what the law allows you to do would be the first thing. And then just kind of get out in the community and talk to doctors and see like what the needs are of your community. I think that one of the most common misconceptions is that some pharmacists may think, oh, well, the doctors may see me as encroaching on their space or something like that. I really haven't found that to be an issue at all. I think doctors welcome this kind of thing because it allows them to focus on their more complexly ill patients, their patients that really need a lot of time and energy. And frankly, right now, they're overburdened, they're overworked, they're overstressed. They don't have time to be doing, really short, quick things like a nasal swab and a simple testing and treatment of these types of conditions. So just talking to your community leaders and seeing what you need can go a long way to where you might be able to fit in with that.
I love that. That is a great thing to talk about. And we talk a lot, I've talked a lot about interprofessional collaboration. And the more we do, the better we can treat patients in our community. And absolutely, then you'll get a good understanding of what are they seeing a lot of, and then, how can I be of service? I love that. I think that's great. So what does an independent pharmacy have to do in order to go about doing this as well?
The biggest thing for us was that it was a change in your workflow, like in any pharmacy, but I mean an independent community pharmacy, but really any community pharmacy. Your workflow is set up to do a certain thing, right? To fill prescriptions. And this is not that. So your workflow has to look a lot different for this. And that was one of the challenges that we had, was just figuring out how this fits in. How do you make time? Because, you can take appointments for something like this, but people want convenience. They want walk-in. They want to be able to have it on demand. And I get that. I mean, that's how it works. So you have to figure out how that looks in your workflow. So for us, it was a lot of staff buy-in. It was a lot of making sure that everyone understands kind of the whys behind it. Like, why are we wanting to do this? Why is this so important for our community? And then how do we make time for it in our day? So that's one of the biggest things. And I mean, not just from a workflow, from a labor standpoint, but where are you going to do this in your pharmacy? Like, where are you going to set up? How are you going to, do you want to bring sick people in and sit in your waiting room with healthy people? Do you do it in a separate area? So what does all that look like? So just kind of, I think the more you can have sorted out about that ahead of time, the easier it will flow for you once you start to see those patients. Word of mouth is a very powerful thing. So we saw once people found out that we were doing this, we would just get people in off the street because they heard it from someone else, or they knew that we did it, or they saw maybe our Facebook ad or something like that. So the more you can sort out ahead of time, the smoother it will be for you when you get started.
Yeah, workflow, that's huge. And I will say workload will be something we'll hear a lot from community pharmacists, and that's a big stressor, obviously, for them as well. So what are the payment models? How does that look right now?
So we knew
in the state of Florida.
We knew that when we started it, especially pandemic era, there were some carve-outs for the ability to bill for example, testing for COVID, right? But we knew that wouldn't be sustainable. We knew that we'd move into a post-pandemic world, so we had to figure out what that looked like afterwards. Now, the easiest way for us to get off the ground was a cash-based model, and that was great because we were able to offer it at a price point that is underneath and competitive with similar offerings from walk-in clinics and urgent care clinics. So these are where people would turn to if we weren't able to provide this service, but still well underneath what you do for an emergency department or an urgent care or something like that. The problem is that cash only opens yourself up to those that have the means for it.
Right.
So we really do look toward the ability to bill for Medicare and Medicaid as something that will be integral to the success of the program going forward. Now, while we're waiting on that to kind of become a reality for us, cash has become a way for us to get our name out there and to get, our service known. But I think that, it's a misconception to say that because it's a cash model that you wall yourself off to anybody that has insurance. Plenty of people have insurance. I tell people, you have car insurance, but your car insurance doesn't pay for an oil change. So it's very similar for this. People have insurance, but that doesn't mean that they have to use their insurance every single time. And when somebody sees something that is convenient and at a good price point, they'll be happy to pay for you rather than have to wait in urgent care, wait for a doctor visit, wait for something to open up, a walk-in or a cancellation or something like that. So those are things that work in our favor to be able to do
and
this.
we forget some people's copays are actually pretty high too, so it could be comparable to something like that. I think it's something that patients need to look into then.
Right.
So not automatically assume that it's out of their range for cost.
Absolutely.
And I think, though, that's been the holdup for community pharmacies in general, especially some of our retail pharmacies, is trying to figure out how would that fit in the workflow on top of how do they get reimbursed for that as well. And so
I would say to people, just don't worry about that part of it. Like launch your product. If you only get a few people that bite because it's cash, that's still a few people that you didn't see before.
Yeah,
and on
absolutely.
top of that, it's kind of like it's a chicken or the egg argument. Like insurers want to see that the value that we provide is worthy of their payment. So let's show them the value that we can provide, and then it's like it almost compulses them to pay at that point. And that has happened in other states. Texas, very recently has earned provider payment for services for pharmacists. And one of the ways that they did it was they were able to demonstrate the great value that pharmacists provided in services like these.
Right. And how can we demonstrate it unless we do it?
Absolutely.
So you just kind of have to jump into it. Okay. So what acute conditions does your pharmacy test for? You hinted at some of them.
Yeah. So respiratory conditions are a big one, of course. Flu and COVID, especially this time of year, is something that people they want that answer. They want to know, do I have this? Do I have that? Can I get treatment for this? Or is it something different or something like that? So we definitely offer a lot of that. But one of the things that the Florida legislature gave us is great latitude in what they consider to be a simple type infection. So we have protocols in our pharmacy for things like lice, for example. And if you're, like me, the parent of a school-aged child, there's data that show that in the Southeast, over-the-counter lice treatments have like a 60 to 80% failure rate. So people are looking for stronger, more efficacious products than what's available over the counter. At the same time, I think while most pediatricians are happy to see their patients, it doesn't take a pediatrician to diagnose someone as having lice.
Sure. Yeah.
So having a pharmacist be able to provide that is something that I think is very important. And from a business standpoint, oftentimes the best word of mouth referral that we could get is to have one child that we can help with a lice treatment. You know that they're part of a school, you know that they're part of a class,
absolutely.
so you're going to get referrals from that. So lice has been something that was neat, and I really didn't think that maybe we would use a lot of, that we have used in the past.
No, it makes sense.
Yes, so
and
we
they
offer
need those
that.
treatments. They'll just keep running through those over-the-counters that aren't working, and so that's great.
Yeah, so that's cool that we have that protocol. The physician that we work with is a great partner. He's got a good mind for this kind of thing, and he really allows us to think outside the box and try that. We've done some women's health things before as well. We have protocols in place for simple, like UTI, uncomplicated yeast infection for women. That's something that we have in place. It's something that's harder to market. It's something, but it's something that is well within our scope to be able to do, to test for and to treat in the state of Florida. So those are some protocols that we have. I just think it's important for people to know that I don't want to pigeonhole us into test and treat means swabbing someone's nose for flu or for COVID. Like we have strep. Like I said, we have lice. You can do skin infections, toenail fungal infections.
Sure.
Those are things that, like I said, doesn't take a doctor to write a prescription for. And it's something that we can provide, added value to our patients by being able to do that.
I completely agree. That's fantastic. So do you have any other advice or information, maybe some anecdotal advice that you've seen from doing this that you could share with our audience as well?
So, I definitely think that we learn a lot by doing stuff the wrong way, and I think that's okay. Like that will happen.
Okay, right?
So I would say biggest piece of advice is don't try to bite off too much at one time. Like we were fortunate in that. When it was COVID, we were solely focused on testing and treating for COVID, and then during flu season, flu as well. Right. But we did not try to do the whole smash all at one time. And I think that it's a very big change to your workforce and your labor and your workflow to do it all at once. So don't try to do it all at once. Do one thing or two things and do it really well and really get that in a rhythm. Without that, I think you end up trying to be like a jack of all trades and master of none. And I think that your chances of success are a lot lower if you try to like scattergun it all rather than just kind of focus in on one thing that you can do really well.
That makes sense. That makes a lot of sense. Okay, well, let's switch gears a little bit and tell us a little bit about your role at the FPA and what you do in regards to independent pharmacy as well.
All right.
Hopefully you can share that.
Yeah, sir. So I am the current president elect. So I'll be starting my term as president commensurate with the June FPA annual meeting. This is something that
which is in Tampa this year,
that's right. It's at and very excited. It's in June this year too, which is a little earlier, which is cool.
I think is great.
So I think that the FPA is something that I knew. And I always tell students that I take, or really anyone who will listen to me, that's like, your profession is so important, and someone is always advocating for your profession. But they may not be advocating for what you think is important to your profession. So I thought, I couldn't gripe about it unless I was willing to roll up my sleeves and do something about it. So I decided to, help in any way that I could. And I've been involved in the FPA with some of their legislative activities. I've been involved with some of their community and independent community pharmacy advocacy activities. But, when this came up, and it came up at a time where the FPA was, needing some help and support in what was going on with the FPA. So I said, okay, I'll do it, so what I try to do is just see not just what's good for me and my practice, but just what is good for Florida, what is good for pharmacy in Florida, what will be good for patients in Florida, and try to put myself in kind of those shoes and advocate from that perspective. And I think that some of the things that we're doing in the FPA right now are really, really great. I think we've made tremendous strides legislatively. We've made great strides reaching out to students and reaching out to pharmacists who maybe have pulled away from the FPA in the past. And so I'm very excited about what we have and what the FPA has in store for us right now.
No, that's great. So tell us a little bit about, because I know you've also been a part of the Independent Academy with the FPA for quite a while. Talk to us about that.
So the Independent Academy is something that I didn't really know a lot about when I became involved with the FPA. And I realized that the FPA's job is so hard because they are advocating for all of pharmacy.
All pharmacy, yes.
And there's a lot of difference in what I practice versus what you practice versus what other people that may be watching this practice.
Right.
The Independent Academy is a way for us to say, we love all of pharmacy, but there are some things that are very unique, bespoke to our part of the profession. That's kind of hard to navigate.
Yeah.
And so the Independent Academy can get all of us together and all on one page, kind of singing from the same hymnal to say, we know what's wrong with independent community pharmacy. We know how to fix it. Let's all get on the same page, get an agenda together, and really make our voice heard. Sure. So when the Independent Academy was being restarted in FPA, I said, oh, this is really cool. I'd love to be a member. And they said, well, the chairperson gets to be a member as well. So I ended up, being a co-chair for it. And I've been really proud of the work that we've been able to do. We've got some great legislation that got passed last session. And we've really educated a lot of people about, there's a lot of misconception about what community pharmacy looks like, what independent community pharmacy looks like, where it's headed. Is it dying? I didn't know that mom and pop pharmacies were still a thing. And so us being able to dispel a lot of those misconceptions and really advocate for our section of the profession as well as all of the profession. You can't be a member of the Academy without being a member of the FPA. Right. So I mean, you're in it for everyone, but you're able to lend your voice to what you see and your cause. So it's been a great marriage there, and I really, really think it's a great thing.
And I think that is so incredibly important, is that we do need to continue to have that unified voice, which has been sometimes a challenge in the past, I think, for pharmacy in Florida. But I think it's gotten a lot better. I think we've been working with the other organizations. All the organizations have been working together much better. So I know that's continued on, which is fantastic.
No, I totally agree. And I think that our profession is so much more alike than it is different, whether it's hospital pharmacy, academia, community pharmacy, chain community pharmacy versus independent community pharmacy. There's still so much common that links it together in a thread that those are the things we can all get on board about and then really lend our voice to some of those more special and specific parts. So absolutely, it's been really great for us in this state.
Couldn't agree more. So we haven't had a legislative update, speaking of which, in quite a while. So can you share with us what's going on right now in the legislature?
Yeah, absolutely. So we're in our I think right now this will be the 6th week. So we'll have the 6th, 7th, and 8th week. We have 3
Feels
weeks
like
left.
I was just in Tallahassee with the students not long ago. Wow.
It really is. It's a
and
sprint.
it was just starting.
Absolutely. And so we've got a couple things that are going on right now. So one of the large things that we saw come up was a bill that would allow pharmacies to be operated without the physical presence of a pharmacist, which happens in a few dozen other states right now. The difference is that the way that the bill was written in this state, it would have provided a lot of latitude compared to things could happen in a pharmacy that did not have a physical pharmacist, that as the laws are currently written, can happen in a pharmacy where there is a physical pharmacist. Like, for example, a remote pharmacist could supervise more technicians than you can currently supervise when you're physically present with those technicians. So we really had some problems with this bill. It was really just, we felt like not the right way to go about it. The good thing is we have really developed as the FPA a reputation for the go-to. So we had lawmakers reaching out to us saying, hey, what do you guys think about this? What does this look like for your practice? And we were very honest. We said, hey, this is probably not the right way to go about this. So while anything can happen in the legislative session right now, I can pretty confidently say that for at least another year, this is something that's going to stay on the table and not make it into the book this year.
Okay. I get a lot of questions about it, by the way. And you can see a little bit of arguing in regards to, well, we need to have more time for things like we've just been talking about, test and treat. So how do we make that time if we are mired down with all these other things that we have to do?
And I agree with that. Yeah. I think that there is something to be said for freeing up the pharmacist's time to practice at the top of his or her license. Mm-hmm. I just think that going from what we have now to completely removing the pharmacist from the pharmacy department, that's a really, really big step. And I think that while the pandemic has definitely showed us the usefulness of, for example, telemedicine and a physician's ability to diagnose and treat, asynchronously or with other ways that we hadn't thought before.
Right.
Pharmacy is ripe for some of that change. We just really didn't believe that this was the way to go about it.
Right. That
so
makes sense.
Another thing that we've seen in the legislature right now, it's so cool because we haven't had a pharmacist in the legislature in several decades. Mm-hmm. We have 2 right now.
I know, it's amazing.
Representative Franklin is very passionate and is having, it seems like, some good success with a bill that would allow pharmacists to prescribe and dispense pre-exposure and post-exposure prophylaxis for HIV. And this is something that it just makes sense from a public health standpoint. Someone who has a needle stick or was a victim of an assault or something like that has a very limited time to start post-exposure prophylaxis.
Right.
Anything that we can do to broaden the scale in which these drugs can be provided to a patient within that very urgent time window is something that I think is very admirable. Now, pre-exposure prophylaxis is something that is unfortunately a little more politically charged. We're not sure if pre-exposure prophylaxis will end up making it to the finish line.
So it might just be the post?
It may just be the post-exposure prophylaxis, but I still think that represents a big shift in what the pharmacist can do, because even right now with test and treat, it's something that you already have, a condition that you already have. You're testing for something and then giving treatment based on that test. This is something where it's like, we're trying to prevent. So we're moving to preventative. It is a preventative type care service. Sure. It's not what someone thinks about when they typically think about preventative type care. Right. But I think it represents a pharmacist's autonomous ability to now do something before something happens rather than kind of acting retroactively. So I think it represents a somewhat large shift in what we're able to do. And I think that it will just be, when we look back at it, the first of many changes that we can see to the pharmacist's ability to practice proactively in the state of Florida. So that's something that we're very excited about. I think it represents a really great thing that we can do for the public in the state.
I agree. And some of you may have heard it as pep and prep. Right. But yeah, absolutely. So where are we in that whole genre? Like,
So it's been
we have the
successful.
bill?
Yes, it's been
Okay.
successful in several committees.
Okay.
Both bills on the Senate and the House side are moving through.
So they're two separate bills.
That's
that have
right.
been
Yeah,
okay.
and they are a little dissimilar now. So we're still, and I know Representative Franklin doesn't need us at the FPA, but he's working very hard to kind of get everybody on the same page with those and do what needs to be done so that the Senate and the House all agree so that we can see passage of this bill within the next few weeks. So I think that we're still very we're still very favorable on this bill right now, and it's exciting time.
That is very exciting. Any other bills? One that I think about, I get a lot of questions about too, is pharmacist prescribing for patients with substance use disorders. So we know that other states, they allow pharmacists to do some of this, and it's actually a federally, we do have the ability to some degree if we'll take it up in the states. So
the legislature this year had an initiative. They call it Live Healthy, and Live Healthy was a big set of policies and proposals that would really just change the way that healthcare is delivered in the state. And one of the things that we've argued for is that now is the time that we can really look at substance use disorder, especially as it relates to opioids. Why? Well, we all know that this has been a problem for a long time, but a lot of the lawsuits and the injunctive relief and the money is starting to flow from federally to the states to say, here's the funding that we have for substance use disorder and the treatment and prevention of other, opioid use disorder cases in the state.
Right, especially with opioids, yeah.
So being able to say, okay, great, you have all of this money. I think Florida's portion was, I don't know, over $1 billion.
It's a lot,
I mean, I think Duval County alone was something like $50 million over 18 years or something like that. So there's a lot of money. So it's like, okay, but pharmacists can participate in this. We can help with this, but we need the tools to be able to do that. Right. So I think that our policies and our viewpoints that, again, pharmacists can practice at the top of their license, that they can identify these types of disease states, they can, adequately, effectively treat these types of things, are things that we've always been advocating for. It's hard to say we need to carve out just for pharmacists for XYZ disease state for XYZ condition, right? But being able to say, hey, as you guys work through this, and there's a lot of things that need to be worked through to figure out what this looks like in Florida for treating these patients, remember that pharmacists can do these sorts of things. And that's why I think it's very important for right now. I've heard legislators say before, oh, well, I didn't know that, many pharmacists participated in test and treat and things like that. And it's like, if the legislature gives us the ability to do something and not a lot of us take advantage of it, then they're going to think, oh, well, pharmacists are content with what they do right now. They don't want anything else. And that couldn't be further from the truth. And I know a lot of us don't feel that way. We feel like we do want to be able to help our communities more.
Absolutely. I know our students say that all the time. Yeah. So
being able to, to show what we can do with the tools that are currently given us is the best way that we can show what we can do going forward with new tools that maybe haven't been considered yet for us.
I couldn't agree with you more. That's fantastic. So get out there and do it.
That's right.
I mean, we have the ability. Let's do it.
Absolutely.
So is there anything else you wanted to share in regards to legislative updates or anything that our listeners maybe should be aware of?
I love this kind of thing because things move so quickly. I was getting texts on the way over here today just seeing how certain things were going and meetings that we have scheduled within the next few weeks. Things just happen so quickly. So I think that, there are things that are coming down the pipeline both in the federal level and at the state level as it pertains to things like test and treat, things like getting payment for services. And I think it's just so important for everyone to be engaged with us, with the FPA, with other pharmacy groups, with stakeholders, with your local doctors and hospital systems and things like that, because
legislators, anything you can get involved with.
Exactly.
Yeah, absolutely.
Because you need to know, what people are looking for solutions for and how you can help be part of that solution. So I just think getting engaged, staying engaged is something that will help us the most as it pertains to legislative efforts.
Absolutely agree. So is there anything else our listeners, you talked a lot about that, but what else do you want to share, I guess, with our listeners? You've really been so amazing for pharmacy. I'll just say that for a long time and continue to do so. what words of advice or what can you leave our listeners with today?
So I can tell, I'm not shy about the fact that the reason why I started to become involved with not just the FPA, but just with pharmacy groups in general was because I really didn't like the direction that I saw my profession heading. And so it's like, I think it's so important that if you're not part of the solution, you're part of the problem. And like, I don't mean to say that to be ugly, but it's just, we need more people involved. Like, we need membership. We need engagement. I meet people, I can think, I met a pharmacist and they're like, oh, I haven't been an FPA member in a while, or, I let my membership lapse. It's like, okay, well, you're still a pharmacist. You're still working as a pharmacist. I said, okay, well, oh, you live down in this district. Do you happen to know so-and-so? Talking about the president of the Senate. Oh, yeah, I know them all the time. I see them at Rotary Club. And I'm like, those kinds of connections are invaluable for what we're trying to do. This is sometimes it's not what you know, it's who you know kind of business.
Sure.
And the more people that we have, the wider net that we can cast, the easier it will be for us to really be good stewards of our profession and really advocate for our patients and what we need to do in order to be able to put our best foot forward in this state. So I just think it's so important. Please get more engaged. Like, I'm never going to be upset if someone texts me or emails me or calls me, hey, how can I help? What can I do? What do you need? That is what we need. It's not just... I know sometimes people will hear me say that we need more membership and they'll hear we need your dollars. That's only a part of it. The FPA, you can go on our website, like our 990 tax return is on there. We only derive a minority portion of our total revenue from membership dues, right? The majority of our funds come from sponsorships. It comes from CEs that we put on. It comes from conventions. It comes from, businesses that support us and things like that. So, the membership dues is only one part of it. I would say more than membership dues. We need you to have some skin in the game. That's why we have membership dues. Right. But more than that, we need your time. We need your talent. Like, we need people to, not just be a member, but serve on committees. That's one of the things that I'm working through right now is putting together committees, chairs, figuring out what our goals are going to be over the next year for reaching out to the public, educating people about what we do at the association. And I need people to make that happen. Like, I cannot possibly do all of that myself. The FPA staff, the board of directors, we cannot possibly do that ourselves. We need people to say, I can commit to that. I can do one meeting a month for a year. I can work on, making some social media posts or making some emails or some letters to prospective members. I can, go talk to pharmacy schools about why newly graduating pharmacists need to be members. Things like that are just, they're so needed right now for us. And I think that it was hard during the pandemic. I think that we lost touch with some people. I think that we didn't see where we were headed. Everyone was just so focused on the here and now. And that's not a bad thing. COVID was unlike anything we'd ever seen before. Right. We needed to just put our heads down and work as hard as we could on the problem that was in front of us. But now in this post-pandemic world, we need to get back to the business. We need to get back to the business of pharmacy. And to do that, we're going to need not just me and not just you, but we need everybody to kind of roll up their sleeves and really, get involved in our association again. So that's my biggest thing right now is just, I don't know everyone in Florida. I don't know every pharmacist in Florida, but I would love to get to know you. Give me a call or shoot me an email and tell me that you want to help, and we will find a place for you. That would be my number one ask.
I love it. And we hear a lot of complaining about what's going on in pharmacy today, but unless you do something about it and you jump in and try to help out with the profession, there's only so much you can do then.
It's so true.
We need the numbers. We need the numbers for sure. Well, thank you. This is extremely helpful. You've provided a lot of great advice for our listeners and for everyone. I feel like the future of pharmacy is very bright when we have people like you in it. It's very, very helpful. And I know our students appreciate it because, remember, they're going to be out there very, very soon doing this, doing what hopefully you're doing. I'd love to see many of them out there doing that. So
thank you.
Thank you for coming on today. Yep. We greatly appreciate it, and I'm sure we'll have you back on again.
Awesome. Thank you. Thank you, guys.
Well, thank you, everyone, for listening today. And please remember to subscribe to the YouTube channel as well as to our podcast, wherever you might listen. Take care.